welcome to the Deep Dive. Today we're tackling something that's probably got your attention if your furry friend's eyes are looking a little less bright than usual. Conjunctivitis in dogs.
Pink eye, basically.
Yeah, exactly. In simple terms, we're talking about inflammation of that pink tissue, the conjunctiva that covers the white part of their eye and, lines their eyelids.
And chances are you're either dealing with a goopy-eyed pup right now, or maybe you're just the kind of proactive owner who wants to understand more about common dog health issues before they become a problem, right? Our goal in this deep dive is, well, to give you the straight facts about what causes this, how your vet figures it out, and what the usual treatments involve.
Without burying you in complicated jargon.
Hopefully not.
Exactly. We've dug into a veterinary reference for this, so you can be confident we're sticking to reliable information. Okay, so let's get right to it. What exactly is this conjunctiva we keep mentioning, and what happens when it gets inflamed?
Okay, so think of the conjunctiva as like a protective, moist lining for the eye. It's actually made up of a few parts.
Okay.
You've got the bulbar conjunctiva, which covers the eyeball itself, the white part.
Right.
Then the palpebral conjunctiva lines the inside of the eyelids. And then there's the part associated with the third eyelid, that little flap in the corner.
Okay.
So when conjunctivitis occurs, one or more of these areas becomes inflamed, essentially. They get irritated and react.
So it's not just one simple trigger then. Our source talks about primary and secondary causes. What's the key difference there for us dog owners?
Yeah, that's a really important distinction. Primary conjunctivitis is when the inflammation starts right in the conjunctiva itself.
Okay, like the source of the problem is right there.
Exactly. Think of it like an allergy directly affecting the eye, or maybe an infection taking hold there first.
Gotcha.
Secondary conjunctivitis, on the other hand, is more like a symptom of another underlying eye issue. So, for example, if a dog has dry eye where they don't produce enough tears, KCS is the abbreviation.
Keratoconjunctivitis, you're correct.
That's the one. Think of it as the eye just not having enough natural lubricant. Well, that dryness can irritate the conjunctiva and lead to inflammation.
Makes sense.
And similarly, if a dog has an eyelid abnormality like entropion,
where the eyelid rolls inwards.
Yeah, the constant rubbing of the fur on the eye surface can cause conjunctivitis. So treating only the conjunctivitis in these secondary cases, well, it won't really solve the long-term problem, you see.
That makes total sense. So conjunctivitis is mainly an eye thing, but it can be a big sign of something else going on. Our source says it's pretty common in dogs. What are the key things we should be looking for? Like the signs that might make us think, uh-oh, maybe it's conjunctivitis.
Well, there are several sort of telltale signs. Squinting is a big one. Vets call it blepharospasm.
Just holding the eye partly closed.
Yeah, if your dog is constantly narrowing their eyes, that's a sign of discomfort. You'll often see redness in the white part of the eye, which we call conjunctival hyperuremia.
Hyperuremia just means more blood flow?
Exactly, increased blood flow causing that redness. And there's often some kind of discharge. This can really vary.
Okay.
It might be watery, seriousness, or more mucus-like, mucoid, or even thick and pus-filled, that's mucopurulent.
Right, the really gunky stuff.
Yeah. The tissues around the eye can also swell up. We call that chemosis.
Puffy eyelids.
Pretty much. Sometimes you might even notice these small bumps called follicles forming on the back of that third eyelid.
Oh, okay.
And less obviously, maybe, the eye could look a bit sunken in, that's an ophthalmos, or the third eyelid might just be more visible than usual.
Wow, okay, that's a really helpful list of things to keep an eye on, literally. Now, let's dig into those many potential causes. Starting with infections. Our source says that bacterial infections are actually quite rare as the primary cause in dogs. That's interesting.
It is, isn't it? Most people probably think goopy eye automatically means bacteria.
Yeah, that was my first thought.
But what's fascinating here is that when we do see a bacterial infection in the conjunctiva, it's usually a sign that something else is weakening the eye's natural defenses.
Like what?
Most commonly, dry eye, KCS. When the tear film isn't doing its job properly, it just creates this environment where bacteria can more easily overgrow.
Ah, okay. The defenses are down.
Pretty much. There's also a specific situation called conjunctivitis neonatorum, which affects newborn puppies before their eyes even open.
Really? How?
It's caused by a buildup of discharge under those still closed eyelids.
Oh, wow.
Our source also lists some specific viruses that can cause conjunctivitis, things like canine herpes virus 1, canine distemper virus, canine adenovirus 2.
So viruses too.
Yep. And while less common, we should probably mention parasites too, like leishmania, onchocerca, and thalassia.
Eye worms.
Yeah, not pleasant. And sometimes conjunctivitis can even be a clue that there's a more widespread systemic infection happening elsewhere in the dog's body.
So the bottom line is, if your dog has conjunctivitis, don't just assume it's a simple bacterial thing you can fix with over-the-counter stuff.
Exactly. It's much more likely a sign of an underlying issue that really needs a vet's attention to figure out properly.
Okay, so infections are definitely something to consider, but often they're not the starting point. What about immune-related problems? Our source mentions allergic conjunctivitis.
Yes, allergies are a very, very common culprit, especially in dogs that already suffer from allergic skin conditions, what we call atopy.
So if they're itchy elsewhere, their eyes might react too.
That's often the case. Then we have something called follicular conjunctivitis. You see this more often in younger dogs, usually under about 18 months old.
Okay.
It's thought to be caused by the conjunctiva kind of overreacting to chronic stimulation by various environmental antigens, allergens and stuff.
Like pollen or dust?
Could be, yeah. We also see lymphocytic plasmacytic conjunctivitis. This one is diagnosed more frequently in German Shepherds.
Oh, interesting.
And it can sometimes be associated with another condition called pannus, which affects the cornea.
Right.
And interestingly, this type of conjunctivitis can also be linked to broader systemic immune diseases, like pemphigus. So, the dog's own immune system can definitely play a pretty significant role in causing eye inflammation.
It sounds like the immune system can really stir things up. What about things from the outside? Trauma or just environmental irritants?
Absolutely. I mean, if a foreign object gets stuck in the eye, a grass seed is a classic one, or a bit of dirt, that's a very direct cause of irritation and inflammation. Pretty obvious, right?
Yeah, definitely painful.
But even less obvious things like dust, smoke, chemical fumes, or even certain ingredients in some eye medications themselves can irritate that delicate conjunctiva and lead to conjunctivitis.
Like getting dust in your own eye.
Exactly the same idea. It gets red, uncomfortable, watery.
Our source also mentions something called ligneous conjunctivitis. That sounds quite specific.
It is quite rare, thankfully. It's a particular type of conjunctivitis characterized by this thick, firm, almost wood-like discharge.
Wood-like, wow.
Yeah, and it seems to occur more often in young female Doberman pinschers for some reason.
Mm-hmm. Okay. And then there's that whole category of conjunctivitis that's secondary to other pre-existing eye problems. That seems like a really important piece of the puzzle you mentioned earlier.
It really, really is. Because if you don't fix the underlying thing, the conjunctivitis just keeps coming back.
Right.
So, as we touched on, problems with the tear film are a major factor. This includes both not producing enough tears, that's KCS or dry eye.
The quantity.
Right. And also having tears that are of poor quality and don't lubricate the eye effectively.
The quality matters too.
Definitely. Then you have eyelid issues. We mentioned entropion, where the eyelids roll inward.
Rubbing the lashes on the eye.
Exactly. And the opposite, ectropion, where they roll outwards, which can lead to exposure and drying. There's also something called medial canthal pocket syndrome, eyelid tumors, and even issues with eyelashes themselves.
Like how?
Well, you can have ingrown eyelashes, that's trichiasis,
Mm-hmm.
or extra eyelashes growing from weird places on the lid margin, that's distichiasis, or even eyelashes growing from the inside surface of the eyelid ectopic cilia.
Ouch. That sounds painful.
It usually is. All of these can constantly irritate the conjunctiva.
Makes sense.
And even conditions that prevent the eye from closing properly, like facial nerve paralysis or just the shape of the eyelid opening, called lagophthalmos, that leads to dryness and then inflammation.
So exposure keratitis, basically.
Exposure leading to conjunctivitis, yeah. And finally, problems with the tear drainage system. Blocked tear ducts, that's dacryocystitis, or maybe the openings aren't formed properly, imperforate punctum, all that can contribute too.
It's almost like a chain reaction, isn't it? One problem sets off another.
That's a great way to put it. So if your dog has recurrent conjunctivitis, it's absolutely crucial to investigate these potential underlying structural issues.
It's like a domino effect in the eye. Okay, our source also mentions referred inflammation. What exactly does that mean? Is that different from secondary?
It's slightly different, yeah. Think of it like, okay, imagine a fire starts in your neighbor's house, but then it spreads to yours.
Okay.
In the eye, if there's significant inflammation in another part, say a corneal ulcer, which is a scratch or wound on the surface of the eye,
Right.
or maybe nodular episcleritis, inflammation of the tissue layer under the conjunctiva, or anterior uveitis, which is inflammation inside the eye,
Yeah.
or even glaucoma, that high pressure inside the eye.
So deeper problems.
Exactly. That inflammation can sort of spill over or spread to the conjunctiva, causing it to become inflamed as well. Conjunctiva isn't the initial problem, but it gets caught in the crossfire, so to speak.
Got it. So with all these potential triggers, infections, immune issues, trauma, structure problems, referred to inflammation, wow.
Mm.
What makes some dogs more prone to getting conjunctivitis in the first place? Are there specific risk factors we should be aware of?
That's a good question. Our source specifically highlights two major risk factors. Atopy, which is that general allergic tendency.
Right, DHE dogs.
Yep, and KCS, or dry eye. Dogs with allergies tend to have more sensitive eyes anyway, and they're just more likely to develop allergic conjunctivitis.
Okay.
And dogs with dry eye, well, they have a compromised tear film. That tear film normally helps protect the eye from infection and irritation. Without it working properly, they're much more susceptible to developing conjunctivitis from all sorts of causes.
This really underscores how important it is to get a proper diagnosis from a vet, doesn't it? You can't just guess.
Absolutely not.
So how do they typically go about figuring out what's causing a dog's conjunctivitis? It sounds like it could be tricky.
A thorough eye exam is, well, absolutely the first and most crucial step. The vet needs to rule out any other underlying eye diseases that might be causing the conjunctivitis or might be more serious.
Okay, so what does that involve?
It involves checking things like the size and symmetry of the pupils, looking carefully for any signs of inflammation inside the eye, like aqueous flare.
Like floaty bits in the front chamber.
Kind of, yeah, it indicates inflammation. They'll also gently try to push the eyeball back into its socket, that's globe retropulsion, to check for any issues behind the eye, like swelling or a mass.
Okay.
And then performing several key diagnostic tests. The Schirmer tear test is essential.
That's the little paper strip.
Yeah, the little paper strip tucked under the eyelid for a minute. It measures tear production, so it diagnoses or rules out dry eye. That's critical.
You mentioned that needs to be done first.
Always first, because any other eye drops or stains put in the eye beforehand can totally throw off the reading and give you a false result.
Oh, okay, good tip.
Then they'll likely use fluorescein stain, that bright orange dye.
Right, I've seen that.
It does two main things. It sticks to any scratches or ulcers on the cornea, highlighting them in green under a special light. And it also helps check if the tear ducts are draining properly. You should see the stain coming out the nose after a few minutes if the ducts are open.
Clever.
Measuring the pressure inside the eye, the IOP or intraocular pressure, is also really important to rule out glaucoma, which can also cause red eyes.
So redness doesn't always mean conjunctivitis.
Not at all. And it's important to note, if the redness in the eye looks very deep and the blood vessels don't move easily when you gently move the eyelid, that might suggest the inflammation is in a deeper layer, like the sclera or episclera, not just the conjunctiva.
Okay, subtle clues.
Yeah. And if there are any unusual growths or masses on the conjunctiva, a biopsy might be necessary to figure out exactly what it is. Could it be cancer? Or maybe that nodular episcleritis we mentioned?
Right. What about blood tests?
Routine blood work is usually normal in straightforward conjunctivitis cases. You'd really only run it if you suspected a more widespread systemic illness was involved.
Okay, so it's not just a quick look. There were specific tests involved.
Mm.
Our source gives a bit more detail on these diagnostic procedures. Can you walk us through those key things the vet will be doing again?
Sure. So step one is that really careful visual examination. Looking closely at the eyelids, are they rolling in or out? Any abnormal eyelashes, any redness or swelling, looking at the skin around the eyes, checking for any foreign material, especially under the third eyelid.
Getting a good look everywhere.
Absolutely. Then, as we said, the Schirmer tear test, number 1, measures tear quantity.
Right.
Then the fluorescein stain checks for corneal ulcers and assesses tear duct outflow, the Jones test.
Jones test, okay.
They might also do a tear film breakup time test. This assesses the quality of the tear film, how quickly it evaporates or breaks apart on the eye surface.
Ah, quantity and quality.
Exactly. Measuring intraocular pressure, IOP, to rule out glaucoma. Gently pushing on the eyeball, globe retropulsion, to check for orbital issues behind the eye. Using magnification and a bright light, like with a slit lamp or ophthalmoscope, to look closely at the structures inside the eye for any signs of inflammation there, like uveitis.
A lot to check.
There is. If that fluorescein stain doesn't drain down the nose as expected, they might try flushing the tear ducts with sterile saline to see if they're blocked and maybe flush out any debris.
Okay.
Now, if there's that thick yellow or green discharge, the mucopurulent kind in dry eye has definitely been ruled out,
Right.
then a bacterial culture and sensitivity might be taken. You swab the conjunctiva and send it to the lab to identify the specific bacteria and see which antibiotics work best. Ideally, you do this before starting any topical antibiotics or using stains.
Makes sense.
In some situations, conjunctival cytology might be useful. That's where you gently scrape some cells from the conjunctiva and look at them under a microscope.
What can that tell you?
It can help identify the type of inflammation, like lots of lymphocytes and plasma cells might suggest an immune-mediated cause. Eosinophils might point towards allergies. You might even see bacteria directly or rarely, inclusion bodies suggesting canine distemper virus.
Wow, okay.
And a conjunctival biopsy, where a small piece of tissue is actually removed for analysis, that's usually reserved for cases where there's a mass, or if the conjunctivitis just isn't responding to treatment and the cause is still unclear.
And allergies.
Right, if allergies are strongly suspected based on history and signs, intradermal skin testing, similar to allergy testing in humans, might be recommended to pinpoint specific allergens.
That's a pretty comprehensive workup.
Yeah.
It really shows why you need a vet. Okay, so once a diagnosis is made, or at least strongly suspected, what are the usual approaches to treating conjunctivitis in dogs?
Well, for most straightforward cases of primary conjunctivitis, treatment can definitely be managed at home, as an outpatient. However, if the conjunctivitis is actually a symptom of a more serious underlying eye problem, like a deep corneal ulcer that needs aggressive treatment, or maybe glaucoma, then hospitalization might be necessary to address that primary condition more intensively first.
Right, treat the root cause. What kind of at-home care advice might a vet give, depending on what's actually causing the conjunctivitis?
Good question. It varies. If it's thought to be due to an irritant, the main thing is usually just to gently flush the eye really well with a sterile eye wash. Get the irritant out.
Makes sense.
For allergies, or maybe that follicular conjunctivitis, applying a cool compress can sometimes provide temporary relief. Your vet might also suggest applying a thick artificial tear gel before your dog goes outside.
Like a barrier.
Exactly. It creates a bit of a barrier against allergens like pollen. And then maybe flushing the eyes gently with eye wash when they come back inside.
Okay.
If the issue is related to anatomy, like ectropion, those droopy lower eyelids, or that medial canthal pocket syndrome where debris collects, then daily, gentle cleaning of those areas to remove any trapped gunk and discharge is usually recommended to prevent buildup and irritation.
What about things like how active the dog can be or their diet during treatment? Does that usually change?
Generally, no. There aren't usually restrictions on your dog's activity level unless maybe the underlying cause is something serious that requires rest.
Okay.
But obviously, if a specific contact irritant or an acute allergic reaction is suspected, you'll want to avoid further exposure to whatever that trigger is.
Common sense.
Right. And if the conjunctivitis is thought to be potentially infectious, it's probably a good idea to keep your dog away from other susceptible pets until it clears up, just to be safe.
Good point.
Dietary changes aren't usually needed for conjunctivitis itself. But if the vet suspects an underlying food allergy might be contributing, maybe the dog has skin issues too, they might recommend a food elimination trial to see if that helps the eyes as well.
Okay. Now, giving eye medications. That can be tricky, right? Wrestling with a dog, trying to put drops in. What are some of the really important instructions owners need to know?
Oh, yeah, it can be a challenge. That's a great point. A few key things. If your vet has prescribed both eye drops, which are solutions and ointments,
Yes.
always apply the drops first. Then wait at least 5 minutes before putting in the ointment.
Why the wait?
So the drop has time to absorb and doesn't just get immediately washed out or blocked by the thicker ointment.
Okay. Makes sense.
Also, if there's any discharge around the eye, gently clean it away with a warm, moist, clean cloth before applying any medication. You want the medicine to reach the eye surface.
Right. Clear the way.
Exactly. And it's crucial to follow the vet's instructions precisely on how often to give the medication and for how long. Don't stop early just because it looks better.
Finish the course, like with antibiotics.
Pretty much. Owners should also be told to contact their vet immediately if they don't see any improvement within a reasonable time, or if the condition seems to be getting worse, or, if they notice any new problems or possible reactions after starting the medication.
Don't wait.
Definitely not. And finally, the big one. If your dog is rubbing and pawing at their eyes.
Yeah.
An Elizabethan collar, the cone of shame, is often absolutely essential. It prevents them from causing further damage to the eye or rubbing out the medication. It's annoying for them, but really important for healing.
Okay. Good to know. Are there ever situations where surgery is needed to address conjunctivitis or, the issues that are causing it?
Yes, definitely. Sometimes medical management isn't enough, or the underlying cause requires surgery.
Like when?
Well, in cases of that follicular conjunctivitis, if the follicles on the third eyelid are really large and bumpy and just don't shrink down with medication,
Yep.
a minor surgical procedure to sort of scrape or debride them might be considered. It helps smooth out the surface.
So,
And obviously, if eyelid abnormalities like entropion or those extra eyelashes, distichiasis, are the underlying cause.
right, the structural things.
Exactly. Surgery to correct those issues either temporarily in young growing dogs or permanently will be needed to stop the ongoing irritation. Otherwise, the conjunctivitis will just keep coming back.
Makes sense.
Surgery might also be an option for addressing blocked tear ducts, trying to open them up. And of course, for removing any tumors that might develop on the conjunctiva.
Okay. Now let's talk about the medications themselves. What are the typical go-to drugs for different types of conjunctivitis, starting with bacterial?
Okay, so for bacterial conjunctivitis, the initial treatment usually involves a broad-spectrum topical antibiotic eye drop or ointment, something that covers common bacteria,
Applied how often?
typically several times a day. And it's usually continued for at least a few days after the signs seem to have completely resolved, just to be sure.
And if that doesn't work,
If the infection isn't getting better, that's when the vet might recommend that bacterial culture and sensitivity test we talked about.
to find the right antibiotic.
Exactly. To identify the specific bacteria and determine which antibiotic will be most effective against it. In some more severe cases, or if there's concern about deeper infection, systemic antibiotics, pills, or liquids given by mouth might also be necessary.
Okay. And those puppies with neonatal conjunctivitis.
Right. For them, the eyelids often need to be gently opened first to allow all that trapped discharge to escape. Then you typically treat with a topical antibiotic ointment.
Got it. What about viral causes, like herpes?
Conjunctivitis caused by canine herpes virus is often actually quite mild and might even resolve on its own without specific antiviral treatment.
Oh, okay.
But in more severe cases, or if the cornea is also involved, then topical antiviral medications like Cidofovir, trifluridine, or idoxuridine might be prescribed by the vet.
All right. Now for the immune-mediated types, allergies, follicular, that sort of thing.
Yeah, for immune-mediated conjunctivitis, the treatment approach really depends on the specific type and how severe it is. Allergic and follicular conjunctivitis might initially be managed just with supportive care like artificial tears and regular flushing to remove allergens.
Okay.
If that's not enough to control the inflammation, then antihistamine eye drops or topical corticosteroids might be used to actively reduce the inflammation.
Steroids for inflammation.
Exactly. For that lymphocytic plasmacytic conjunctivitis, especially the kind seen in German Shepherds, topical corticosteroids, often something like dexamethasone, are usually the first line of treatment.
Okay.
The dose is typically high initially, and then gradually reduced, tapered over time to the lowest effective dose. Sometimes, for long-term management, the vet might switch to a different type of immune-modulating drop, like cyclosporin.
To reduce steroid side effects long-term.
Precisely. And importantly, if allergies are suspected to be contributing to any of these immune-mediated conditions, identifying and addressing those underlying allergies, whether environmental or food, is absolutely crucial for long-term control.
Right. Treat the whole dog.
You got it. And finally, for tear deficiencies, both the lack of quantity, PCS, and poor quality.
Yeah.
Cyclosporine drops or ointment are often used to help stimulate the dog's own tear production. And in both types of tear deficiency, using viscous artificial tear lubricants frequently throughout the day is really important to supplement the natural tears and protect the eye surface.
Lots of options.
Yeah.
Are there any situations where certain eye medications should absolutely not be used? Contraindications?
Yes, absolutely. This is critical. Topical corticosteroids, while fantastic for reducing inflammation,
Yeah.
should generally be avoided if there's a corneal ulcer present.
Why is that?
Because steroids can actually slow down the healing of the cornea and potentially make the ulcer deeper or infected. Very risky.
Okay. Big warning sign there.
Huge. They should also be used with caution, maybe avoided in patients who are at high risk of developing an ulcer, for example, dogs with severe dry eye or those with eyelid issues like entropion that are rubbing on the eye.
Got it.
And it probably goes without saying, but in cases where an active infection is known or strongly suspected, using a corticosteroid without also using an appropriate antibiotic or antiviral can just make the infection much, much worse by suppressing the eye's defenses.
Okay, so steroids need careful consideration.
Oh.
What about general precautions when using any kind of eye medication on our dogs?
Well, topical eye medications, even artificial tears sometimes, can occasionally cause mild irritation or stinging in some dogs. It's always a good idea to just observe your dog for a few minutes after applying the medication, see if they seem more uncomfortable, squinting more, or rubbing.
Okay.
With topical corticosteroids in particular, as we just hammered home, there's that risk of corneal ulcers developing, even if one wasn't there initially. So your vet will likely want to monitor your dog closely, maybe rechecking with fluorescein stain periodically.
Right.
If you, as the owner, notice any increased redness or more pain, or maybe the eye suddenly looks cloudy or bluish, you should contact your vet immediately, as that could signal an ulcer forming.
Good advice. Our source also mentions some alternative corticosteroid medications. Are there other options besides dexamethasone?
Yes, there are. Other topical corticosteroids that might be used include things like prednisolone acetate, betamethasone, and hydrocortisone. The choice often depends on the specific situation, the severity of the inflammation needed to control, and sometimes just your veterinarian's preference and experience with these different drugs. They have slightly different potencies and penetration into the eye.
Okay. What kind of follow-up appointments are usually needed after starting treatment for conjunctivitis? Is it a one-and-done visit?
Rarely one and done unless it's super simple. Typically, your vet will want to re-examine your dog fairly soon after starting treatment, often within maybe 3 to 7 days, just to see how the eye is responding to the medication. Is it getting better? Any side effects? Then, depending on the underlying cause and how well the treatment is working, further recheck appointments might be needed. Maybe every few weeks, or perhaps less often if it's a chronic condition being managed long-term, like KCS or allergies. It really varies based on the case.
Okay. And looking ahead, are there any things we can do to help prevent our dogs from getting conjunctivitis in the first place? Or is it just bad luck sometimes?
Well, some causes are hard to prevent, like a random foreign body. But prevention largely comes down to managing any underlying conditions that make a dog more susceptible.
Like the risk factors we talked about.
Exactly. If your dog has been diagnosed with dry eye, KCS, consistent lifelong use of their prescribed tear lubricants and cyclosporine is crucial to keep the eyes healthy and reduce the risk of secondary conjunctivitis.
Okay.
For dogs with known allergies, working closely with your vet to manage those allergies, whether it's through diet changes, environmental controls like air purifiers, allergy testing and shots, or medications that can also significantly reduce the likelihood of allergic conjunctivitis flare-ups.
Makes sense.
And simple things like regular grooming, especially for long-haired breeds, can help prevent hair around the eyes from growing too long and causing physical irritation.
Good practical tips. Finally then, what's the usual outcome we can expect for dogs with conjunctivitis?
Right.
Is it generally curable?
The prognosis, the expected outcome, is generally very good when the underlying cause of the conjunctivitis can be accurately identified and effectively treated. That's the key.
Finding the why.
Finding the why. So, for example, if it's secondary to dry eye, managing the dry eye well will usually resolve the conjunctivitis. If it's due to an eyelid or eyelash issue, surgical correction often provides a permanent solution, and the prognosis is excellent.
That's good news.
Bacterial infections typically clear up well with the appropriate antibiotics, although, as we've discussed, it's important to address any underlying issues, like KCS, that might have made the eye vulnerable in the first place, or it might recur. Allergic or follicular conjunctivitis may require ongoing management, especially during certain times of the year for allergic dogs, but they can usually be kept under good control with medication and avoidance strategies.
So, manageable.
Often very manageable, yeah. That lymphocytic plasmacytic conjunctivitis tends to be a more chronic condition. We often aim to manage it rather than achieve a complete cure. Long-term, low-dose medication might be necessary to keep the inflammation suppressed and the dog comfortable.
So the big takeaway here seems to be that while conjunctivitis in dogs is super common, it can stem from a really wide variety of underlying causes. It's not just one disease.
Exactly right.
And that's why getting that thorough diagnosis from your veterinarian is just so crucial. It ensures your dog gets the right treatment targeted at the actual problem so they can feel better as quickly as possible.
Precisely. Being aware of the different signs to watch for and understanding that, hey, this red eye might actually be a clue to a bigger issue like dry eye or an eyelid problem, that really empowers you, the owner, to seek the most appropriate veterinary care for your companion. Don't just ignore it.
Yeah, absolutely. And on that note, here's maybe a final thought for you to chew on. Considering how connected your dog's eye health is to their overall well-being and their environment, everything from allergens floating in the air to those little eye-level interactions they have with grass and bushes. What subtle changes in their behavior or maybe their surroundings might be giving you clues about their eye comfort,
Oh.
even before it gets really red and goopy.
Hmm.
It's definitely worth paying attention to those little details and being proactive in their care. Thanks for diving deep with us today.